Good evening, everyone. Welcome to the session of Conceptual Spine Connect today, where we are going to talk about failed back surgery syndrome or failed back. So, this is also the persistent spinal pain syndrome. Why exactly is the difference in the terminology? We are going to discuss that. So, intervertebral disc herniation as a cause of lumbago and sciatica was described. And this basically lesion is a treatable lesion surgically. This basically caused the stream of surgical practices into the spine. So until then, as such, when we used to talk about the pathologies in spinal cord, they were not treatable or operable. So since it was discovered that this intervertebral disc herniation is something that can be treated surgically, this is how the Pandora's box opened up in regards to the surgical techniques in spine. Low back pain is one of the most leading causes of disability worldwide. The age standardized point prevalence in 2017 was around 7.5%, and the lifetime prevalence can be as high as 65 to 80%. So, age point prevalence by 2017 was 7.5%, and prevalence in the lifetime was as high as 65 to 80%. That means 65 to 80% of the people are going to incur back pain during their lifetime, one or even more times. And generally, it was seen that the prevalence increases with age, and it is peaked around 80 to 89 years of age, and then it decreases. It has become one of the most common healthcare problems these days, and it is one of the most common causes of loss of man working hours and also loss of the GDP. As a consequence, large number of patients with low backache who sought treatment, a substantial increase in those undergoing surgery has been observed in the past 2 days. As has the spine surgery flourished, so did the reports of unrelieved or even worsened pain following surgery. The first term that was used to describe these cases was post-laminectomy syndrome in the year 1975. So, as the surgeries have flourished, so, obviously, if ever the amount of surgeries are going to increase, the complications are going to be incurred only then. If there is no surgery, there is no complication as such. So when we talk about the increase in number of surgeries, so that is how this particular cases came up more and more over time. And in the year 1975, when the first time this was described, it was described as an entity as post-laminectomy syndrome. And in the year 1977, it was renamed as failed back surgery syndrome. Over the time, the usage of the term failed back surgery syndrome has increased exponentially, while the alternative labels have been declined. However, one major challenge with this is that, whenever we talk about failed back surgery syndrome, that causes a lot of misconceptions, be it with respect to the patient or the surgeons. So there are a lot of definitions of this particular entity: persistent, new, recurrent low backache or lower extremity pain following one or more spine surgeries, lumbar or cervical pain of unclear origin, either persisting despite surgical intervention or appearing after surgical intervention for spinal pain originally in the same anatomical distribution. Again, I'm repeating: persistent, new, or recurrent low backache or extremity pain following the spine surgery. The patient underwent a spine surgery either for low backache or for the leg pain. Talking about lumbar spine over here. So after the surgery, the patient has got some persistent back pain or the lower extremity pain. That basically means that this is a failed back surgery syndrome. Lumbar or cervical pain also of an unclear origin despite the surgical intervention, or that appears after the surgery, that is basically in the same distribution, can also be classified or defined into the same. Chronic radicular pain that persists or recurs in the same distribution despite anatomically satisfying previous spine surgery. So basically, you achieved a thorough nice decompression, and in spite of achieving a thorough nice decompression, this particular patient comes back to you with the pain. So that will also be defined as a failed back surgery syndrome. Persistent or recurrent pain in the back. So the pain would be persisting after the surgery, be it in the same intensity or lesser. Along with that, there is a pain in the back, in the neck, or the limbs, despite the surgery or the treatment. So that will also be defined as a failed back surgery syndrome. So I'm repeating over here: patient undergoes a surgery. The patient has the same pain in the back or in the legs, a different intensity pain in the back and the legs. Thorough decompression is achieved, but still the patient is having pain. So these are all the definitions of failed back surgery syndrome. Surgical end stage after one or several operative interventions on the lumbar neurexis indicated to relieve low backache, radicular pain, or combination of both has not resulted in improvements. So basically, you have done the surgery, you have decompressed all the nerve roots, and in spite of decompression, entire nicely like a thorough decompression, still the low backache or the radicular pain or a combination of both has not uh, gotten satisfying relief. The outcome of lumbar spine surgery does not meet the pre-surgical expectation of both the patient and surgeon. So if ever the patient is undergoing surgery and after the surgery the patient doesn't has complete relief of the back pain or the leg pain, so that is also something that is going to be defined as this particular entity. Failed back surgery syndrome describes a post-surgical patient population with suboptimal outcomes such as persistent pain and functional compromise. So basically, it is a post-op patient with not a good outcome, and the patient still has pain, and still he has got some compromise in regards to the activities of daily living, which will be basically defined as a functional compromise. Does not necessarily define a failed surgical procedure, because generally the impression would be that the surgery is not done correctly, the surgery is not done adequately. The implications technically a successful operation which has not been able to produce an improved long-term clinical result or an outcome. So basically, even though the surgery was a success in regards to the decompression, but that is not replicated in regards to the outcomes clinically, as well as able to produce the uh, functional outcomes as well. So the patient has got the residual symptoms, because of which functionally the patient is not able to still be completely happy, or the patient is still having numbness, pain, tingling, some of the residual symptoms.